Hello, I'm here to talk to you today about the metabolic disease process known as diabetic ketoacidosis. We're going to start first by talking about some signs and symptoms and comorbidities that might be associated with diabetic ketoacidosis. Patients often present to the emergency department with hyperglycemia. They may have an odor of ketones, which smells somewhat sweet, nausea, vomiting, extreme thirst, dilute urine, tachycardia, tachypnea, weakness, and can even have altered mental status. And usually this progresses very quickly. So the patient might come in and report that they've had like nausea and vomiting that started either earlier that day or even the previous evening. And then they may have been trying to drink, but they're unable to drink because of nausea and vomiting, yet they're still having high output of urine. Other things to look that you'll notice symptoms of it are that they'll have elevated blood glucose, elevated ketone level in their blood and or urine, metabolic acidosis, and a positive anion gap. It's more likely to occur in type 1 diabetics versus type 2 diabetics due to the insulin deficiency, but it's becoming more and more prevalent in type 2 diabetics. Often too, you'll have a patient who presents with unknown history of diabetes, and they'll come in with diabetic ketoacidosis, and this is their new diagnosis of diabetes. Patients with elevated triglycerides, compromised liver functioning, and elevated cholesterol levels are also more likely to develop diabetic ketoacidosis. The pathophysiology of the disease process, it's a very complicated disease process. Diabetes is a condition with abnormal insulin secretion and or production. So since this is just a short little snippet, I'm just gonna hit the high points. This can be due to B cell destruction or because of increased insulin resistance associated with obesity and or metabolic alterations. Diabetic ketoacidosis can often be the first presentation of an individual with new onset diabetes, as I mentioned previously. Diabetic ketoacidosis is a hormonal imbalance where the liver releases glucagon and the body is unable to process it appropriately due to insulin deficiency. This abnormality of regulatory hormones is that in the absence of insulin creates hyperglycemia in the patient. This leads to glucose-induced diuresis that serves to further dehydrate the patient and cause tachycardia, tachypnea, and renal impairment. In addition, there's also lipolysis, decreased protein synthesis, and increased protein breakdown, causing further ketosis. Types of treatment options or gold standard testing for diagnosis include it's imperative to treat with fluid resuscitation, insulin drip to gain control over blood sugar, and treat electrolyte abnormalities, including hypokalemia. The gold standard for testing for diagnosis is a complete metabolic panel, venous blood gas, and beta-hydroxybutyrate. The beta-hydroxybutyrate is the definitive test because it is the metabolic process of ketoacidosis. Related differential diagnoses include HHS, which is hyperglycemic hyperosmolar state, and the other one is a new one called diabetic ketoacidosis, EDKA, which is where they have the same symptoms of DKA with no high blood sugar. Thank you.